So tonight we're going to shed some light on it and show you what we see oftentimes with our in our office. We're going to talk about some case history things that not only I've seen in my office, but I bounce off of occupational therapists. I've talked to people at Nationwide Children's, and I've talked to other health professionals, and they notice the same trends, but haven't necessarily put all the pieces of the puzzle together. And that's what we're going to hopefully do tonight. So while I'm going through this, I see if you've already used the chat box and messaged me, let me know that you can hear me. But if you have any questions while I'm going through this, please don't hesitate to put a question out there in the chat box, and I'll do my best to answer them either while I'm kind of going through our material tonight, or if not, at the end, I will definitely take some time and read through the chat box again and hopefully answer as many questions as you have. Um, and um, and hopefully we shed some light on what's happening with our kids. So let me bring up my slides here. There we go. All right, cool. So we call this the perfect storm, and we call it the perfect storm because, there's not really just one thing. It's a combination of a lot of things that's happening and a lot of things that have come together at the same time that's really affecting a whole population of kids. I have been doing this talk since about 2017, so a couple of years now. And I am actually a part of an organization called the National Wellness Foundation that I meet regularly with other doctors around the country, and we talk about these findings and we train together and we go over some of the scans that we're going to be going over together, look at case histories, and do everything we can to help these kids. We actually just last weekend we're in Minneapolis doing another training with some of the most amazing doctors around the world, really, and talking about what we're seeing, and we're in the process of raising funds to help fund more research for these kiddos, and we'll talk about that a little bit later today too. But this is the perfect storm, and when we talk about the perfect storm, we're going to give some action steps, hopefully for parents tonight, that you guys can take and you can use. And they say knowledge is power. We've always heard that saying before, but in reality, it's applied knowledge. If tonight I do this talk and you take all this information and you say, man, that guy was good, I appreciate all that information, you feel more knowledge, but you don't take any action on it, I've kind of failed you. So my goal is to give you something you can do to take tonight that you can put some action steps to really help your kids. Quick background about me and why I'm so passionate about this is I'm originally from Northwest Ohio. Grew up in a small town before I moved to Columbus. And like most people in my hometown, we go to Ohio State, do our undergrad, and then never leave. So I did go to Iowa for about 3.5 years. I went to Palmer College of Chiropractic and then moved back. And I've been in practice for almost 13 years now, but I've been the owner of Proactive Health and Wellness since 2015. Why I'm passionate about this subject tonight is because I'm a dad. This is the reason why I do what I do. The little guy sitting on my shoulders right there, that's Owen. He's my youngest. He's 4 now. And Hudson, my older one, will turn 7 here in a couple weeks. So I, like a lot of guys graduating chiropractic school, wanted to be the sports guy, right? So you take all the sports trainings, you work on the sidelines, and that's kind of the most guys I think coming out of chiropractic school. And then something changes about almost 7 years ago now, and that's that little guy standing right there that completely changed my direction in practice and completely wanted to do everything that I can to learn to help make sure that he's not one of the statistics. And it hasn't been easy, to be completely honest with you. Last year about this time, my oldest son had some pretty severe anxiety issues, to the point where he didn't want to leave the house, where when we went to the church festival, he didn't want to ride on any rides. When we went to a restaurant, he kept asking, Daddy, am I going to be okay? Am I going to be okay? Do I need to go home? And I get this because I've lived it. It's hard to see your child hurt and to sometimes feel helpless. And it puts stress on not just the child, but it puts stress on the entire family. I know firsthand. but I also know firsthand that there's hope. Um, so we just had our church festival this year. Last week, he rode on every ride multiple times, got done with his first year of school, did awesome in school. Um, we're planning a family vacation, and he hasn't, I haven't heard, I can't even tell you the last time I heard him ask me, am I going to be okay? So I've been there, I've been in your shoes. And I'm also fortunate that I get to see the other side. I get to see a child thriving. And that's why I'm here. That's why at 9 o'clock at night, instead of being up snuggling my boys, I'm down here trying to reach more parents and more families and let them know that this is something that's real. So the first thing we're going to watch is an awareness test. And so with this video, what I want you to do is um, just follow the instructions. They're going to ask you how many passes does the team in white make. So try to count. They're going to pass the basketball around. Just try to follow that.
This is an awareness test. How many passes does the team in white make? Go! The answer is 13. But did you see the moonwalking bear? Go!
There he goes, right in the middle. It's easy to miss something you're not looking for. That's the kind of the moral of this one. It's it's easy to miss something you're not looking for. So something has changed, something's different, something's going on, happening right in front of our eyes. A lot of times when I talk to parents, they kind of know that something didn't seem right, but we're told it just happens all the time, and it's commonplace. So we're going to talk about what's different and what's changed. What really is the perfect storm? The perfect storm is a story of stress. It is stress from even, I say fertility and pregnancy challenge. So it happens pre-conception. We see a lot of people with fertility issues, with IVF treatments, and stress around just trying to conceive and get and have a child. And then once you get pregnant, you're measured from day one. We have, how big's a baby growing? How fast is the heartbeat? Is it big enough? Is it too big? Is it too small? Let's do some checks to see their chromosomes. Now we need to do another test to see what your blood sugar levels are. Okay, now you're measuring ahead of schedule. You're heading behind schedule. Like every single thing, all the way up to labor and delivery, is stress mode. Fight or flight is getting stuck on all the time. And then the biggest thing, number two here, is intervention and injury during labor and birth. And we're going to show and talk about C-sections here in a little bit. But oftentimes what I see with these kids who their stress response system is stuck on, or they have some challenges, they had some kind of stress during labor and delivery. It's not 100% of the time, but pretty significantly, 85, 90% of the time. And then when they have that history, we hear stressed, colicky baby, not sleeping, crying all the time, which leads to a stressed, sick infant, toddler, ear infections, snotty, tonsils. Always seems to catch every single little bug every single time they go to school, and which leads to these sensory issues, anxiety issues, stress response, stuck on, trouble focusing in school. And even we're getting to the point now where we get past that, where we're seeing in the teens, we're seeing these headaches and migraines that are chronic. I had a patient the other day, just started care. She's 31, 32 years old. She's had migraines ever since she can remember, probably since she was in high school. Yeah, I had trouble focusing in school. I've always had trouble sleeping. Oh yeah, I had ear infections. I had tubes when I was a kid. My mom said my birth was crazy. I had the cord wrapped around my neck. And we hear the story over and over and over again. And it really starts with, especially number two, some kind of stressful pregnancy, and specifically labor and delivery. So the perfect storm, what it is is basically our stress response system stuck on all the time and won't turn off. We're going to talk a little bit more about this fight or flight, stress response, gas pedal, brake pedal response. Although we're coming back to that because that's really, really important. So this is a quote from Bruce Lipton, who's a PhD, and he said, "The function of the nervous system is to perceive the environment, see what's happening in the environment around us, and coordinate the behavior of all other cells." That's the main thing our brain does, main thing our nervous system does at any one point in time. See what our body's doing in its environment and adapt to what's happening on the fly. So when we talk about, chiropractic, and we talk about what it is I do as a chiropractor, most people think neck pain, back pain, but really it's to allow the brain and body to function optimally, allow the brain to see what's happening better inside the body and adapt to an environment better. And once again, we're going to come back to that because perception is so key, especially when we hear about these sensory processing issues. Sensory input is going to be very, very important, and that's really where we're going to be going with a lot of what we're talking about tonight when we come to a lot of this neurology we're going to get to. So once again, subluxation. When I talk about subluxation, think of it as stress response stuck on and can't turn off. So we're going to talk next about the 5Ds. We're going to just dive right into it. And we're going to talk about the science and where does it start. And the very first D that we're going to talk about today is something called dyskinesia. Misalignment, fixation, stuck. When something's not moving. And we're going to be talking specifically about spine. That's really where most of this starts, if not all of it. And where does that initial trauma start? We're going to show next, we're going to actually show a C-section from a baby's point of view. So I said I started giving this talk in 2017, and before that, I had actually never seen a C-section from a baby's point of view. I had this picture in my mind how it was obviously just rough on mom, but I had this picture on my mind that was actually maybe potentially even easier for baby because baby didn't have to go through the birth canal, right? Then I saw this video, and the light bulb moment for me went off when I saw this from one of my mentors, and I've been passionate about this ever since because this is what I see starts a lot of it. So if you are a little squeamish, a little faint of heart, you might want to close your eyes or turn your head turn your phone around for the next minute or two. But for those of you who can, if you watch this, I think it's all going to really start to come together when you watch this. Oops. So you'll see that that's what they're pulling on there. That's a vacuum. They have it on the child's head.
Come on, buddy. All right. Ears of a girl. Ears of a girl. Make you cute for the camera.
You see how they're... And there it is. Oh, it hurts me every time I see that still. It's the thing that always gets me about that video is the surgeons are just it's just so commonplace. They're making jokes. It looks like the ears of a girl and whistling. And if there was a child on the floor right now and I went and I grabbed it by its head and picked it up and did what those guys just did and handed it to me, if somebody did that to my child, I would try to knock them out, right? That's in no other time, in no other place, in no other setting is that acceptable. But that's how a lot of kids are entering the world. And remember, we're going to come back to this, but remember where this guy's finger's at right now. The amount of stress that they say on the average of C-section, this is from the American Academy of Pediatrics. The average C-section puts up to 60 pounds of pressure on a child's upper cervical spine. That much pressure, that much stress, that much trauma before they ever take their first breath. And that's the story that we're hearing for a lot of kids that come into our office with these struggles. Now, once again, not all. Does it mean that if you had a child that was born vaginally, we can't help them? No, it doesn't. But I would say that this is the really common denominator, some kind of stress, some kind of intervention during labor and delivery. And it's changed. So I was born in 1981. And when we look back in the 70s and early 80s, it was 1970, the C-section rate was about 6%. By 80, 81, we're up around 17%. The World Health Organization says an acceptable rate of C-sections is about 10 to 15%. So please understand me. I am not anti-C-section. If you had a C-section, you shouldn't feel guilty. If you shouldn't feel like a failure. You shouldn't feel like you did something to your children. When used appropriate, it's a life-saving procedure. And I know some people who have had a C-section, and if they didn't do that, either they or their babies wouldn't have made it. I'm not anti-C-section. But what I am against is overuse of C-section. I had a patient one time whose doctor told her that because she was a redhead, she was a bleeding risk, and they weren't even going to let her have the opportunity to have a vaginal birth. They were just going to schedule a C-section. I have a big problem with that. And that happens more and more and more in today's society. When we look at these numbers, in the 80s, early 80s, it was around 17%. We get to 1990, we're around 23%. Around the turn of the century, we're getting up to 24, 26, 28. 2012, last statistic on here, we're at 33%, 1 in every 3 births. And that's pretty consistent from the last set of data that I saw in like 2016, 2017. We're still hovering right around 33, 34%. 1 in every 3 children in this country, that's how they're entering this world. And it puts a ton of stress on the upper cervical spine, and that's so, so important for neurology. That's where we get that dyskinesia. That's where we get that stuck trauma fixation from day one. This is a research article that this is a medical doctor, and he did a study where he looked at dysfunctional joints, stuck joints, in healthy newborns and see how commonplace is this. And he found that in 99 out of 100 infants, at least one pattern of subluxation was found. This is considering just a normal birth. These are all intervention. These were just all kids. There's some kind of pattern there just because birth is crazy, crazy stressful. Not for mom, but for baby too. Obviously for mom, but for baby too. And we have some more references. If anyone else would like to get some more information about this, the information's out there if you dig a little bit. We can share these with anybody if they would like to read them a little bit ago. I had the opportunity, we had a patient, I was just talking to a friend this past weekend who lives in Northwest Ohio. He was giving the same talk in Northwest Ohio to a grandmother. Grandmother had her grandchild and mom come to our office, started care. We're seeing some pretty fantastic results. So the occupational therapist was the one who noticed the most results the fastest. And they said, hey, what's this guy doing? Had me come in and talk. And they said, yeah, we see that in the case history too, but we never actually put it together until they saw that video. It's down at Nationwide Children's Hospital. They said they know that having some kind of birth intervention is one of the big red flags that they see very commonly, but they still haven't necessarily put all the pieces together yet either. So when we have a dysfunctional joint, we have that dyskinesia, the next thing that happens is something called disafferentation. Every single joint in our body has these little tiny nerve receptors that when we move, the nerve receptors fire and it floods our brain with information. And movement is like life. When things are moving, your brain knows what's happening and can see what's happening in our environment and adapts. When we have the joint that's stuck, we lose that movement. We have abnormal input because we're not getting those nerve receptors to fire. And then we get something called nociception, which is like noise. Some people can interpret this as pain, but it's basically noise. It's like Metallica in the kid's brain all the time because your brain's looking for information that it's not getting. And it stresses your brain out. So I'm sure some of you are familiar with something called sensory processing disorder. This is going to go a little bit deeper into what sensory processing disorder actually is, and tell you, and I think it'll describe what proprioception is, which is a really big key here. But this is about sensory processing disorder.
Some kids are really bouncy and can't sit still. Some kids aren't very coordinated. Some see food as a pile of toxic goo that hurts their mouth and jangles their taste buds. School might be a mysterious place where things don't make much sense. If this sounds like you may have sensory processing disorder, and we're going to explain it here. Your body has 7 senses: vision in your eyes, hearing in your ears, touch in your skin, taste in your mouth, and smell in your nose. And you have 2 movement senses: your muscles and your sense of balance. In sensory processing disorder, these senses don't communicate right with your brain. Think of the nerves connecting your brain and senses as a set of roads. Those roads should be smooth superhighways so that the senses and brain can communicate fast. If you have sensory processing disorder, then some of your roads are bumpy and rough. You can also think of the senses as having a broken volume control. If the volume is too high, you will feel your senses too strongly. If the volume is too low, you won't feel sensation at all. In fact, you'll want more. Some kids overcome these problems as they grow older. Others need help. Help is usually occupational therapy, and it's fun. Occupational therapy helps build up the connections between your senses and your brain. The more you do, the stronger and smoother they get, kind of like paving those roads. After a while, you'll learn to slow down and sit still, to pay attention, to eat, to be comfortable and happy doing movement. It takes time. There's homework, too. But the more you work at it, the better it gets.
So that's a really good, one of the best videos I've seen about sensory processing disorder. And really that proprioception is really, really key. The movement is important because every time you move, you flood the brain with information that allows the brain to see what's happening in the body. And as your brain gets information, it's very calming to your brain. When your brain's struggling to find that information, it's not getting that information, it puts your brain in panic mode. And that's when you see kids bouncing off the walls, kids won't sleep, leads to a variety of other issues we're going to get into here in just a minute. But occupational therapy is great to get the kids moving, and it can help pave these roads. What chiropractic is trying to do is trying to get the roadblocks out, trying to get those areas, those centers where that proprioceptors are, get those really working like they're supposed to. When we talk about proprioception, we talk about these little tiny nerve receptors that are feeding your brain, that are giving your brain information. 60% of them are in your spine, and a third of those are in the upper part of your neck, that same area where you saw the doctor with his thumbs and his finger the other day. So if you have an injury from day one, you lose that proprioception, and you lose a very, very significant, a high neuro-rich area. You lose that proprioception from day one. So subluxation is really a sensory processing problem. If the joint's stuck, the proprioceptors don't fire. If the proprioceptors don't fire, your brain can't interpret them. Oftentimes we see sensory processing disorder as a brain type of issue, and really it's your brain has an issue because it's not getting information it needs, and the issue is more other places not moving, specifically spine. So we're going to go next into dysautonomia. So you have a stuck joint. The nerve receptors in the joint, around the joint, don't fire because there's no movement. When there's no movement, your brain doesn't get information it needs. It puts your brain in panic mode and engages the fight or flight response. So this is another quote from Dr. Bruce Lipton. He said, "You cannot be in growth and protection at the same time." And that's really, really important. And it's so, so true. When we talk about growth and protection, we're talking about something called the sympathetic and parasympathetic nervous system, your fight or flight response and your parasympathetic brake pedal response. The example that I give to patients and parents specifically all the time is, let's imagine right now there's a bear in the room with you. What would happen in our body? Our heart would start racing. We start pumping adrenaline. All of our energy goes to our arms and our legs, and we're either going to fight the bear or more likely we're going to take off running, right? So while we're running away from the bear, excuse me, take a step back. We're going to run away from the bear. We're running away. That's our sympathetic nervous system. That's our fight or flight response. And that's an appropriate response. We need to have a stress response, and it's there to help protect us. That's a good thing for us to have. But while we're running away from the bear, are we worried about taking a nap? Nope. Are we worried about digesting our lunch? Nope. Are we worried about fighting off the flu bug? Nope. Are we worried about growth and development? Nope. It's 100% protection mode when we're running away from the bear. So fight or flight is protection. Parasympathetic, rest, relax, is brake pedal, which is sleep, immune system function, digestive system function, and all growth and development. A lot of these kids who their stress response, their fight or flight system is stuck on, we call them sympathetic dominant. When their stress response is stuck in all the time, we also see they have a lot of gut issues. They have a lot of immune system challenges, ear infection, always sick, right? Sometimes they're not hitting their milestones like we think that they should. And they have trouble sleeping. We're going to see a testimonial here in a little bit about a little boy who wasn't sleeping, and we see some of the stress patterns. We just had a little girl who started care about a month ago, and she was about 3 years old when she started care with us, and her mom and dad said literally since she was a baby, she's never slept through the night, and they would have to literally hold her down for 2 or 3 hours just to get her to go to sleep. That's not normal. That's not okay. And her stress response system just never shut off. Now we're getting that to start up, to shut down and normalize, and balance is the key. We don't want to stop that stress response system completely because, once again, it's important. But we want your body to be able to regulate the two efficiently and tap the brakes when it's appropriate. There's a ton of research about the vagus nerve. The vagus nerve is your body's major brake pedal nerve. And you're seeing a lot of research coming out now about the gut-brain connection and the brain-gut connection. And that's all vagus nerve. That's the nerve. It's called the wonder. It controls everything. And they're finding now that that in a lot of these kids with sensory processing issues, there's an issue with the vagus nerve not working as well as what it should. And right now, a lot of the research has to do with basically shocking the vagus nerve with what's called a vagal stimulator. I would rather just take stress off of it with an adjustment, but that's me personally. But when you look at this vagus nerve, where does it come out? Once again, right there at the very top where the brain and the upper part of your neck meet, that's where it exits your spine. And once again, there's a lot of stress around that area if there's some kind of intervention during birth. So dysautonomia means an imbalance within the autonomic nervous system, the last one we're talking about. Basically, their stress response system, their fight or flight system, all gas and no brake. They're not balanced. So dysautonomia will eventually lead to dyskinesis, abnormal energy output. We see these kids bouncing off the walls. We see their muscles are just tight and spasm and rigid, and they don't sleep. They're just always on. And when we kind of track it back, we see it as an abnormal energy output, but really it's due to an abnormal information input. Stressing out your brain, high energy, all the time, stress response system. This is that paper I was just talking about, that they're actually finding that children with sensory processing disorder, they have issues with the parasympathetic nervous system. The brake pedal part of the nervous system is a problem, specifically that vagus nerve is a problem in kids with sensory processing issue. They're all gas and no brake. We need to find a way to tap the brakes. And there's a lot of really cool research now showing that chiropractic can change something called heart rate variability, which is a direct indicator that we're influencing the vagus nerve and we're influencing the parasympathetic nerves. So we'll talk about that in the test we do in our office. So the fifth D is disconnected. You know, we see a lot of these kids that they've been in their stress response system has been on so long, they're so fatigued, their system is so tired, they're so go all the time, their brain is so stressed for such a long period of time, they just can't make the connection. There's really cool research now showing that chiropractic adjustments can actually affect the prefrontal cortex, a part of your brain that has to do with emotion and connection. But a lot of these kids have just been under stress potentially since they were conceived. And most likely from when they're born. You know, the baby wires with stress, right? So if mom's stressed during pregnancy, baby is wired to be stressed from day one. But especially if they have that history of trauma or stress during labor and delivery, that's the main thing we see in a lot of these kids. So the question is that I get that, Dr. Reinhart, man, that makes sense. What about my kid? Like, how do we know if that's the story for my kid? Oh yeah, you nailed my kid to a T, you described him perfectly, or maybe that doesn't describe your child. How do you know if it's something you can help with or not? And we rely on technology. You know, I use this technology and I'm invested in this technology because I haven't found anything else better than that. And it really tells me such a great story when a child comes into our office, because you know that child can't communicate to me what's going on. They can't say, yeah, Dr. Reinhart, I really feel like I'm having trouble sleeping at night, and when I'm sitting in school, I just don't want to sit down. Like, I mean, they don't say that, right? The scans tell the story for us. The first thing we use is thermography. It's a temperature. We call it Neuralink. And it helps us see where stressors are within the autonomic nervous system. So when we look at the nerves in the nervous system, you feel about 10%. Neck pain, back pain, things, numbness, tingling, sensory things. 90% is that communication to gather information from your body around it and then tell your body what to do to adapt to whatever stresses we have in our environment. Those communication between your brain and your organs and between your brain and your muscles, no matter how much stress there is on those nerves, we don't consciously feel them. So most of these kids don't have pain or don't experience pain, but we still see these stressors. This is an example of one. The white bars mean areas where there's little to no stress. Green is like a mild stress on the nerve. Blue are on here. Blue bars would equal like a moderate nerve stress, and the red bars are severe. So for this child, especially up here in the upper part of the neck, where we see a lot of that trauma, there's a lot of stress, and in C1 specifically, there's a severe stress. When we click on these bars, you can see these little things light up, so we can see where they go. Brain input for C1, but eyes, ears, nose. We see a lot of sinus issues, congestion, ear infection, tubes, and that story. So, and then we can use that to not only see if there is stress we can help with, where the stress is, how severe it is, but we use it as a tool for our re-examinations as well, just because sometimes changes, especially if the kid has been stuck on for a long, long time, sometimes these changes can be slow, and this is how we make sure we're seeing the changes that we want to see over time. The other thing that we do is a heart rate variability test. And this one we try to do on most children, but sometimes isn't always the easiest scan to get. But if we can get a good read, this one specifically gives me a ton of information measuring the fight or flight response, the gas pedal versus the brake pedal, sympathetic, parasympathetic response. So you'll see that the box on the left-hand side right now, the black line in the middle of that chart is complete balance. The further you shift to one side, the more dominant that side is. The left-hand side is the sympathetic fight or flight gas pedal. So the person on the left is very high fight or flight. Their stress response system is stuck on go all the time. The other thing we're seeing with this one on the left is we also want to see the up and down part of the chart. And so if you score up here towards this green box, towards the higher end, this is measuring something called your stress reserve, like your fuel tank for stress. So you want a high reserve, you want a full tank of gas. So when you have stress, you can pull from that fuel tank, manage it, and move on. And what I see is if someone is in fight or flight, they start burning through those reserves. And the longer they're in fight or flight, the further down the chart they go until he's almost in the red here, where they're basically their gas tank is running on empty. They just don't have enough fuel, if you will, energy left to continue to mount a stress response, which sometimes we even see it shift over to the parasympathetic, the brake pedal side, just because the stress has been there for so long and is so severe. But the one on the right, and that's like a perfect scan. That's exactly what we want to see. The little white box is right on that black line, completely balanced. So when this person has stress, whether it's physical stress, emotional stress, or chemical stress, that fight or flight response kicks in, helps you manage that, fight it, or run away from it. And then when the fight or flight response, when the stress is gone, that fight or flight response disengages, the parasympathetic brake pedals kick back in and bring you back down to neutral. That's exactly what we want to see. And if your body is able to rest, is able to recover, then that reserve should be nice and high. But it's a great test to measure, to see, hey, I think my kid's all gas pedal, no brakes. This is how we check it. I got to do a TED Talk a couple months ago, and a lot of it revolved around anxiety and the fact that we have a capacity for stress. There's only so much stress we can handle. There's only so much that our sympathetic nervous system can engage. And so when we see a lot of kids with a history of pretty rough stuff, pretty severe emotional trauma, especially, they're all the way over here, and these poor kids, they know nothing but stress. And your heart goes out to a lot of these kids, because there's a lot of these kids who have a lot to go through that make some of the things that we have to go through pretty minimal. So a couple of stories from a couple kids in our office. This is a patient that came in. Her son every single night would wake up probably 2 or 3 times a night, just would not sleep through the night, couldn't figure out what was going on. And so we ran some scans. And this was the thermal scan like we did the first time. We didn't get a heart rate variability on him. But when we look at the stress patterns, once again, that very, very upper part of the neck is your body's brake pedal. And we see a severe stress at the upper part of his neck. And I love getting texts like this. It says, I'm very happy to report that Ethan asked to go upstairs to bed 45 minutes early last night, which is unheard of, and no nightmares. He got up at 12:15 to go to the bathroom, which is normal for him. He went back to sleep until 6. Thank you. We'll see you next week for a follow-up. So kids putting themselves to bed and sleeping, till 6 o'clock is still pretty early. But if your kid's usually up at 4:30 or 5 a.m., that's a nice little break. And if you don't have to fight them to get down, so you can actually get to bed at a good time, it's just an added bonus. But this is Rocky. Rocky's an awesome little guy. Rocky is a hockey player, and before Rocky started care, he wasn't diagnosed, but I believe he had some sensory processing disorder. He just there was a lot of coordination issues with hockey. He had a lot of anger issues. He led the league, his hockey league, in ejections, which isn't something where we were necessarily excited about. One of the things that really stuck in my mind when we're doing the case history is just Rocky didn't seem to be affected by pain. It didn't seem to faze him. He didn't have a normal response to that input. So he was climbing a tree, fell out of a tree, and as he was falling down, he had this cut go all the way up his arm as he scraped his arm down a branch, and his arm is just covered in blood. And so what's a normal response for a kid? The waterworks start coming. You start screaming, Mom, right, Dad, help. And so Rocky saw this, went inside, found his mom, goes, hey, Mom, I think we might need to get this checked out, maybe go to the hospital or something. Completely calm, completely reserved, not appearing to be in any pain, which isn't a normal response for a child. And so we started caring. When we did his scans didn't look terrible. We saw some moderate stress in the neck, which is once again, that upper cervical is a pretty common pattern for some of the things like this. We saw some mild stress. We didn't see any severe stress. It wasn't lighting up like a Christmas tree. And the reason being is Rocky had been in stress mode for such a long time that his stress response was fatiguing, and he wasn't really even having a stress response. So the example that I give is, let's imagine that there's a house with a smoke detector in it and a fire goes off. And it starts beeping really loud, but nobody puts out the fire. Eventually, even though the fire is still there, the battery's going to wear out and you're not going to hear a beep. Sometimes what we have to do is put the battery back in before we put out the fire. Meaning, sometimes we do these and the scans actually get a little bit worse before they get better. And that's a good thing because we're getting these stress responses to come back on board, which is step number one. But Rocky, one of the first things we noticed with Rocky, as we started getting him, we started getting him aligned and started freeing up his nervous system, allowing his brain and his body to communicate better, is coordination. He started doing drills in hockey that he had never been able to do, or at least had a lot of difficulty doing. He was doing them super easy. He started to notice that it's hockey, right? You're still allowed to fight. So he was still getting fights, but he knew when to stop. He knew when the referees blew the whistle, okay, it's time to quit. It's time to disengage. It's time to calm down. It's time to get my head back in the game and go on, which his mom said before starting care, he had never done that. He never knew when to stop. And then we saw emotional changes with him too. He became a lot happier, a lot less argumentative, just a happier kid overall. And this last one we're going to talk about is Noah. So Noah's mom was a patient before, while he was still in utero. And mom did everything right, the picture of health. And, once again, like we talked about earlier, we're not anti-C-section. Noah was one of those kids that needed to be born via C-section. It was life-saving for him, and we had a happy, healthy baby boy. And I shouldn't say we because I wasn't there. It's not my child, but we do there is a happy, healthy baby boy because of medical intervention. There's a time and a place for it. It's absolutely necessary. But mom, we'd had this conversation before Noah was born, and mom knew what that looked like for Noah, and mom knew that we better get this little guy checked early. So this is Noah's scan. Once again, areas white, good. Green is mild stress, blue moderate stress, red severe, black is worse than severe. This is one of the worst ones that we've seen. He had latching issues. He had some pretty severe sleeping issues, and we got to it super early. The earlier I get to these things, the earlier we can get these kids adjusted, the easier it goes away. Noah just had his first birthday, sleeping through the night. He's ahead of all of his milestones. He's ahead neurologically and developmentally where he should be, and kids just thriving right now, which is awesome. So what are the most common effects we see when we start working with kids? The first thing that we see is when we start to tap the brakes is the calm. A lot of times sleep is one of the fastest things we see. The kids start to sleep deeper. They are less restless. They're not having potentially nightmares anymore. And they just are more relaxed, and they aren't on edge all the time. The second thing is control. They know when to control themselves in certain situations. Like Rocky, he knew when to stop. He knew when the fight was over. When the referee blew the whistle, okay, time to stop. He was able to control himself, and was more appropriate in social situations. The connection is a big thing. When we see these kids come back on board and they start making better eye contact, gosh, there's nothing better. There's nothing better. And then coordination. We see a lot of coordination issues, clumsiness. As we start getting things to come back online, as we start getting those dysfunctions corrected, we start to flood the brain with this neurologic information. The brain can see what's happening better. Once the brain sees what's happening better inside the body, it can coordinate everything so much more efficient. So action steps. What are the next steps for you as a parent? One, ask questions. If you, well, I haven't had a chance to check the chat box here, but if you guys have any other questions, or if you think of something later, don't hesitate to reach out to me. Give our office a call, shoot me an email, send us a Facebook message, however is easiest for you to reach out. Ask questions. If you even want to set up a time to come in and chat, we'll sit down and we do 15-minute consultations where we just sit and chat with parents and then just give them and answer some questions if they have it. We always welcome that. Next thing we want to do is reduce the three T's. Excuse me. What that means is, when we talk about this, it's all about stress stuck on. That's what we've been kind of hitting on tonight. So what engages the fight or flight system? Stress, physical stress, physical stress, traumas, emotional stress, thoughts, and chemical stresses, toxins. So physical stress, chemical stress, emotional stress. Try to eliminate those things. We see changes in diets, right? That makes a difference. We see changes in getting kids more exercise, getting them off of the video games, things like that. All of those are helpful. The more you can reduce those stresses and don't engage the sympathetic, the fight or flight nervous system more than it already is engaged, absolutely do that. The third and most importantly is get your child scanned. Let's see. That's the biggest thing. I don't know if I can help your child or not. I don't know. But I know that when most parents are watching this, the thought goes through their head, gosh, I wonder if that's my child. I wonder if that's why my grandchild can't sit through school. I wonder if that's why my daughter isn't sleeping at night. I wonder why that's why my niece gets sick all the time and has had all these ear infections. The only way I can tell is with the scans. So if it's something that you would like, we're giving everybody an opportunity tonight. If you check your email inbox, everyone who registered should have an email in their inbox right now with a thank you for attending tonight, but with an opportunity to get your child scanned at a discounted rate. Normally for our full exam, we charge $47. That price is actually probably going to go up September 1st. But we're offering between now and the end of August, if you mention that you were a part, that you took place and you watched this perfect storm, we're offering it for $20. And I said earlier, we're part of this organization called the National Wellness Foundation. Something that we're doing is all these doctors around the country, we're all seeing the same thing. We're hearing the same story, and we're seeing changes in these kids across the board. We have a goal as an organization to raise $100,000 and in October fund some more pediatric research that is non-drug, non-pharmaceutical, and give more hope to more parents. If you guys sign up, all those $20, 100%, I'm donating directly to the National Wellness Foundation to help fund more research, to reach more kids, to get more answers, and just to help more people. So it's in your the email should be in your inbox. There's a link actually in the email that will take you to our online scheduler that you can request an appointment. And I think it says mention Perfect Storm in the comments section, so we know to make some special time for you. But like I said, thank you for your time today. Hopefully you guys got something out of today. Hopefully it opened your eyes to a little bit more about what's going on. Maybe helps get a better idea of what's going on with your child. And if anything, if I was able to do anything tonight, what I really want to do is give you guys hope that, like I said, I've been there before. I've had a child with severe anxiety issues, and I get to see the other side of it. I get to see him thriving. I get to see him doing well in school and playing with his friends and going to water parks and going to festivals and having fun and not being overwhelming. That's what I get to. And then I'm passionate to make sure that I'm going to do everything I can to make sure I help as many families just like my family. So thank you so much for your time. Like I said, reach out if you have any questions, and I'll hang out here for just a few minutes and answer any questions if any come up in the chat room. And otherwise, we will talk to everyone soon. Have a great night.